not a good look for our profession.
How in the name of common sense did this ever get this far? Vaccines are not seek and destroy missions.
Because he was so severe.
This is nuts.
One of the top 20 things that she has discovered with her research company, Progenobiome, medicine has been corrupted. Where we go from here now, I don't know. Well, it doesn't work.
So angry, punishable with jail time.
Literally, this makes me believe we live in the Matrix.
Like, deadliest year in U.S. history.
It wasn't a question of if, but when.
First red.
If it doesn't work and it's safe, put it in a little Fauci Pez dispenser, give it to the patient, and shut the family up.
It's going to get worse and worse and worse.
Gave Fauci an award for being a hero of the pandemic.
This has been a problem.
These were lies.
Let's talk about the healthcare professionals supporting this.
In the meantime, what was going on behind the scenes?
Irony of the whole thing is,
Harvey's 100% correct.
This is freaking annoying.
ultimately, we need to have hope for America.
What is going on here? What has poisoned your mind? Buckle up, kids.
Welcome back again to another episode of BS Free MD, and we're thrilled to have back with us Andy Schoonover, founder and CEO of CrowdHealth, for a follow-up conversation. He first joined us in episode 327 months ago and introduced us to the groundbreaking concept of CrowdHealth, which is a platform using crowdfunding to reimagine how we pay for healthcare in America. And since then, his mission to sidestep the traditional insurance model continues to gain momentum, shaking up one of the most complex industries with a simpler, more transparent, community-driven model. And so Andy's background is in finance and entrepreneurship. He has shaped his bold approach to how to tackle inefficiencies in healthcare. And now CrowdHealth is in all 50 states with fresh funding secured and a growing user base. He's back to share with us basically what it is if you haven't heard of it before, what's new, what's next, and how healthcare evolution and revolution is evolving. So welcome back, Andy. Good to have you again.
Thanks for having me. Love being here.
Yeah. So, but we were just saying beautiful Texas skyline in the background. Tell us what's happening with CrowdHealth. And for those that haven't heard before, that maybe they didn't tune in, unfortunately, to the previous episode, what is CrowdHealth? How did it get started and how does it work?
Yeah, thanks again for having me. Don't want to bore listeners again with the total story, but I'll do it quick. But this is my second healthcare company, and I swore after the first one I wasn't going to get involved in healthcare again because, as you said, it's super complex, super regulated. Between the healthcare and the banking sector, I'm not sure which is more regulated. There could be a pretty good podcast argument on that in itself. So for some reason, I've decided to get back into this. But no, I like many of us, had serious healthcare payment issues. My little one was one, and we had a recurring ear infection. So we went to the ear, nose, and throat doctor who told us she had a hole in her eardrum and she needed to get tubes in her ear. So we actually got that pre-authorized by the health insurance plan, went and got that done. It was a 15-minute procedure. Got the bill, and it was $8,000. And I was just like, wow, you doctors are getting paid a lot if I have to pay you $8,000 for 15 minutes. But no, that's the whole point of health insurance. But I got a note from my health insurance company that said it was medically unnecessary, so they weren't going to pay for it, and which I was bewildered by. And I think my ear, nose, and throat doctor, through the appeals process of that, was fighting with a ophthalmologist or something like that internally at the health insurance plan, and they ultimately were like, nope, we're not paying for it. And so I had to stroke an $8,000 check to pay for this procedure, and I was ticked, as you can probably imagine. I called the health insurance plan and I said, hey, if you're not paying my bills, I'm not paying your bills, and I quit. And it was at that point where I tried to figure out how to operate in this complex healthcare system without having health insurance. And ultimately, I figured out how to do that, and CrowdHealth was born. And that was 2021. And we celebrated our 4-year birthday just last week. So exciting stuff. I think the last time I was with you, I don't know how many customers we had, but we were probably at 6,000 customers. We're at 10,000 customers now. So we
Wow.
expect to have around 20,000 customers by the end of the year. And it's just been going delightfully well. As I mentioned before I jumped on or we started recording, you know, the last time I think I was with you versus when we are now, our prices are actually down about 19%. So when's the last time you've heard that healthcare prices have gone down? I've never heard it before in my life, but before CrowdHealth, but we're actually driving these prices down, really well for our members.
Speaking of that, so there are other cost shares like religious cost shares and these kind of things. Is CrowdHealth unique in its negotiating power and how you really focus on negotiating prices down for your members?
I think we are. I was actually a part of a health share for a while, and my frustration with health shares were a couple fold. One was that they limited the amount that I could get funded by the community. And a lot of times that was like $200,000 or something like that. I was like, all right, well, if I have a really big healthcare event, I get into a car accident or, any one of those, like it's going to be more than $200,000. And so I'm paying for something that actually is not going to help me if I have a really big life-changing event. And I think a lot of us are looking for a payment method for healthcare that does help us in those really big events. Like that's the whole point. We want help in the really big ones. The other thing I realized is that they weren't actively negotiating bills. And so, they were basically price takers instead of price makers. And in every other part of the economy, we tend to be, price makers. Like we will go to the service provider or the product or whatever that is a price in which we think we're getting the right value, right? It's a value price transfer. And with health shares, what I have found in my, I was with a health share for about a year, I think, was that they weren't really actively going after helping me find really great prices. And so one of the things that we do with CrowdHealth is we have this database of tens of thousands of doctors and prices where if you're in, I know you guys are in, Sarasota or Tampa or wherever, we know the best doc in Tampa who will help us, get a great cash pay price, and they're willing to give a price that's significantly better than, United Healthcare because they're getting paid directly at the point of care as opposed to having pre-authorizations and having to wait to get the cash in the bank. And, oftentimes this is 3 or 6 months later before they actually get paid. So you rip out all that administrative and all that bureaucracy and they're willing to give you a much better price. So I think what our secret sauce is really is getting people the information, the data to make really good decisions about where they go to get their healthcare services so that you get great quality at a great price. And, that's again, what we try do with every other part of our lives when we're paying for bills. And so we thought we'd take that pretty fundamental, thing in our life and apply it to healthcare. So that's really allowed us to get prices down, and we're getting better and better at it. As I said, we're down 19% over the same time last year. So we're improving upon this as we go.
Whoever would think that actual market principles would work in healthcare? I mean, like that's
Right.
that's the part that gets me, is that it's like people are mystified. They've been hypnotized into thinking that they're going to die if they don't have like regular health insurance. Like it's a really bizarre mentality. Like I would argue with my colleagues and patients for decades. I'm like, it's just money.
Well,
Like somebody's paying for this. It's just money. So if your insurance is being paid by your employer, they could pay you more money and you could just buy your own
Yes.
insurance. No, I have to have insurance. It's like insurance. Well, I'm only working for the insurance. Well, I've heard all of these things and it doesn't make any sense. It's just money. And when you break it down into just money and you say we can use, capitalist free market principles to bring the cost of healthcare down, of course it's going to go down. That's the nature of the beast. It's a law. It's the law of the jungle.
Yeah, amen. And I think, a lot of the reason why we're here is because of government overregulation. That, it's one of the crazy things for me is that, did you know that health insurance plans can't even tell you, they're by contract with all these hospital systems, they can't tell you the lowest place to go for a knee surgery. Like, they're not allowed, and that's crazy to me. So if you called your health insurance plan today and said, "Hey, I want the lowest price for a knee replacement surgery in Tampa, Florida," they contractually cannot give you that information. That's preposterous. And so it's like, just the fact that we can, because we don't have any contracts with hospitals, that's what sets us apart, is we can say, "Hey, we've got a great orthopedic surgeon, in Tampa or Austin or Des Moines or wherever, that is a really great orthopedic surgeon at a really reasonable price." And that's what sets us apart from health insurance plans, is we can do that, whereas health insurance plans can't do that. And that's crazy to me. I mean, that's monopolistic from my perspective. Like, the hospital system says, "No, you can't tell your customer where the lowest price is." I mean, that's crazy. And that's why our healthcare costs are so high.
And oftentimes they don't even know what the cost is because,
Well, the insurance company does.
right.
The doctors don't.
No.
Exactly.
The only reason I know what we charge is because we have a fair number of cash pay patients that come through our urgent cares, and it's $150. It's $150. It's, if I spend 5 minutes, if I spend 55 minutes, it's $150. That's what I'm like none of it really is. I mean, that's not super terrible, but if you have a cold, you needed to spend $0 on your healthcare. So from that perspective, it gets kind of weird.
Right. But
And they
even
probably
a
pay you
bigger
with a credit
procedures.
card or something, right?
Oh, go ahead.
They pay with you with a credit card, or, I mean, how do they pay you? Yeah. As opposed to you having to go bill health insurance and have a bunch of billers and spend 30% of that 150 on just getting paid. You'd be able to give a better price with cash, as opposed to having to go through the billing fiasco of health insurance. I mean, I think the coolest part of that is, now when I go to you, it's between you and me. Like, there's nobody else in the middle. So you can tell me, as my doctor, "Okay, what do I need to do to improve my health?" As opposed to being like, "Okay, what is the health insurance plan going to approve for me to get really great health?" Like, that to me is a reestablishment of the doctor-patient relationship, which it's no longer the patient, employer, insurance plan, doctor relationship. It's the patient doctor relationship, which I think changes healthcare just in itself.
So I'm thinking, and I know a lot of people wonder, like, how does this change though in a system where I think it's pretty self-explanatory that would work well in a system where a physician is a private a system, where he's an orthopedic surgeon, say, working on his own. He's got his own surgery center. They kind of know the cost for the procedure. They can give you the price. But if you were to go to someone that's employed in a big system, pick whatever name you want, where there's so many layers of bureaucracy, and you're going to have some hospital procedure, and the doc is just like one line item, and then you have all these, hospital bills, nursing, etc., and it's going through this. How can people see, or how can you negotiate, see the prices and what that's going to cost?
The vast majority of procedures, the vast majority of healthcare services are outpatient. You don't need to be going to a hospital. And that's what we tell our people, is like, the hospital should be the last place you go. Go to an independent doc who's not a part of the big system. Start there first. There's an orthopedic surgeon, I guarantee you, in your town who's independent and not affiliated with a hospital system. They're the best place to start for a number of reasons. One, they'll give you a better price. And two, I think they're better doctors. I think the better doctors are the ones who be like, I can generate my own business on my own because I'm really good, rather than relying upon the hospital systems to funnel me business. So, those doctors tend to be better doctors from my perspective, from what we've seen. Um, and then if you have to do something large, I mean, you're not doing a heart procedure outpatient, brain, a number of things. You're not doing, outpatient. And if you have to go inpatient, then let us help you find a really good doc at one of the hospital systems to help you that we can, negotiate a really good price with. So we've been able to find really great doctors at really great hospitals that are willing to negotiate a good price with us. And we've done that now, hundreds, if not thousands of times. So it start with non-hospital system. And then if you have to have a hospital system, then call us because we can find you, a great doc. I think the other thing too that people don't fully understand, typically, if you're going to pay more for the Four Seasons, versus the Courtyard, the Four Seasons is way better, right? Like we know that. And so people think that that's the same with healthcare, and it's just not. Oftentimes, we see some of the best docs give the best prices because they're so good at what they do and specialized that, these people are doing 3 or 4 knee replacements a day, as opposed to the guy who's doing 3 or 4 knee replacements a month. And the guy who does it or the gal who does 3 or 4 a day is just better at it. They can do it quicker. When they see a complication, they've seen it before, and so they can get more of these in, and they're just better at it. There's less complications after the fact, and so it's just not the case that some of the most expensive doctors or expensive hospitals even are better than the less expensive places. We got a guy in Austin who does a lot of the joint stuff for the University of Texas athletic program, and he's one of the fairest priced doctors in Austin. He's so darn good at it, and he does these things all day long. And it's almost like making widgets. And I hate to use that analogy, but it's like, if you make the same widget 1,000 times, you're going to be really good at making that widget, right? And you're going to be much better than the guy who's done it, 10 times. And so, some of the best doctors out there are actually the most reasonably priced from what we've experienced.
No, it's fascinating. I had this discussion with a lot of patients that wanted to go to Mexico for, gastric band or weight loss surgery. And I said, and they're like, is this a problem? And I'd see a lot of the patients come back and I'd say, well, okay, so it's going to cost you $4 or $5 grand. It's going to be at least 25 to 30 if you do it in the United States. And do you want a guy that does 100 of these a month or a guy that's done 100 of them in the last 10 years? Because that's the difference. The guy, a lot of these weight loss surgery places in Tijuana, it's 5-star resort. It's the only thing that gets a little bit weird is if you have a surgical complication that's delayed, that's a bit of a problem because you're already back home. But honestly, it's a really fair price, and you are legitimately seeing somebody that almost always has 10 times more procedures than who you would see here. I mean, it's just it's amazing. And that surgeon is making way more money because he controls his business and he controls his volume. It's not like he gets 2 days to operate in the hospital and that's it. He can operate as much as he wants.
Yeah. We actually, funny enough, we had a conversation about this on Telegram, which is just a messaging app. We have about 400 of our members on Telegram, and I kind of go back and forth with them. And I kind of joked this morning. I said, CrowdHealth needs to set up a hospital in Mexico. You go down there, you get your procedure done, and then you sit by the beach or the pool to recover drinking margaritas. I'm not sure how margaritas and pain medicines mix, but it's one of those things where it's like, man, like maybe there's something to this, that there's actually better price, better service, better experience by going elsewhere. Fortunately, we haven't had to do that quite yet, but it's definitely something I'm looking at, because I think this medical tourism thing is gaining steam, especially as our prices in the United States are going up so astronomically.
What about, I was thinking when, Tim was talking about the gastric bypass, but I was even thinking of my dad had a colonoscopy done in Costa Rica of all places and paid this is years ago, but cash for it, $150 or something. And so what about screening procedures like that? Is that something that I know the answer, but I want you to say it, CrowdHealth does for things like that? How does it work in terms of, say, colonoscopy, mammography? Do you buy those on budget, or what do the members do?
Yeah, it's a great question. When I was starting Crowd Health, or when I was kind of in that phase of trying to figure out, how to operate outside of healthcare, I had to get a colonoscopy because my, speaks of family history and stuff. And so I was looking around, and I found the lowest price I could find was like $3,500 for a colonoscopy, which takes no time at all. I mean, it's super fast. And so then I found this one place. It's called Colonoscopy Assist, and they were basically are able to provide you with a colonoscopy almost anywhere in the country for $800. And I'm just like,
Wow.
hold on a second, like what's going on here? Well, the thing I was calling around to all the hospitals because I thought that that's where the place, you get a colonoscopy, you go to the hospital. Well, no, the best places to do them is in some of these, surgery centers and a kind of outpatient center.
Mhm.
It was $800, in, out, easy, easy peasy. And so, in essence, what we've done is been able to, find those types of services. We can send our members there and be like, hey, instead of paying $3,500, pay the $800. And typically it's like the same GI, it's the same, it's actually a better experience because I don't have to go through the hospital. And so it was basically the same thing, but for, 80% less. And so we were able to find people really low priced medical services like that all the time. And people don't know, like mammograms, I think I saw one the other day that was like $175 or something like that. I went and got a stress echo for around $200, and a guy on X messaged me. I put this out on X, and a guy on X messaged me, his Twitter at the time. He's like, my health insurance plan has paid $5,000 for my stress echo. And I'm like, this is absolutely bonkers. And it chewed through his entire, deductible, where he could have paid $200 in cash and not had to pay that. And it's just bewildering to me, kind of the asymmetries that we're seeing with healthcare prices. And this is for, not only these preventative services or these imaging services, but, it gets even worse when you get to some of these surgeries and things where, we've seen surgeries that were priced out at a couple $100,000, but when you actually kind of get into it and do it at a surgery center, it was more like, $15,000 or $20,000. And it's just, those are the prices that you are paying by having health insurance through your monthly premiums, because you are paying for all of these, absurd prices. You're just paying them through your monthly premium. And that's why our monthly premiums are going up, astronomically every year. I mean, you're seeing commercial rates, this year. I was just hearing from people, and they were up, 15, 20% for a lot of these small companies. And it's just like, you're paying for these excess charges that are done primarily by hospitals. Let us help. So we've got, like I said, this database. We're starting a marketplace actually this quarter, where you're going to be able to go in. You're going to say, I need a knee replacement in Tampa, Florida, and it'll give you a list of all the places where our members have gotten knee replacements in Tampa, Florida, what the price is. We'll help you schedule all of that. And so we think it's the biggest cash pay marketplace ever created, and that's our secret sauce.
No, that's absolutely it. Because it should be focused on value, and that's what's just so completely, crazy to me, is that we're not focusing on value. Like, what's value? Value is, I don't have to wait too long to see the doctor. I can actually get a primary care doctor. I get along with that person. We share philosophy. We, on and on and on and on. And that's, I mean, I every single day I try to get somebody to follow up with a PCP. I don't have one. I just moved, or they just retired, or the one my health insurance company told me to see I hate. I mean, that's really common, and so it really, a lot of this is really just empowering people, right? I mean, I have my 3-pronged strategy as far as not how to save healthcare, because I don't really want to save it. I want to see it, completely rebuild, which is take care of yourself. In other words, be fit, take care of yourself, pay for yourself, which is where CrowdHealth comes in, because you're, cost share, price negotiation, all that stuff. And then the last thing is government. The last thing is, how can we deregulate healthcare? How can we leverage technology like like AI to really bring down costs? I mean, 99% of what I see, you could easily do with AI. Do you have a pneumonia? Do you not? Do you, like, all these kind of things? We should be doing that. Instead, I wait an hour to get an X-ray read when machine learning can read it in less than a second, and it's better at it than the radiologist that we're paying $400,000 a year. So there's a lot that we can do. We just have to be willing to change our mindset and not be, addicted to this crack pipe of big insurance.
Yeah, I agree with you. And I think one of the things that I'm worried a little bit about with AI is the training information, training data that it has.
Yes.
I think oftentimes is incredibly misleading. It's going to, these big studies, unfortunately, that were funded by pharma, and therefore getting the results that the sponsors want. I know there's a big fiasco right now with Harvard. The Trump administration is pulling federal funds from Harvard, and a lot of those federal funds were going to research. And I think Harvard has got some of the most garbage research that I've ever seen, because they're so impacted by, third parties that have a desire to see, these studies go one way or another to best benefit their bottom line. So I'm a little bit hesitant on the AI, although I think we're seeing some things there. I think there's some studies that have come out that have shown that people actually enjoy, with the AI experience, and oftentimes prefer it. No offense to the doctors, but prefer it over some of the doctor interventions, especially for the things that, are not, super complex. And so I think there's a place for it. I'm just always kind of hesitant to allow the training data to be, primarily from garbage research. So
that's a really good point. That's a really good point.
Yeah.
Well,
because
right.
it depends what information they're feeding it. It's going to be your outcome on what the recommendations are.
That's how, when you asked Google, draw me a picture of George Washington, and it was like a black woman.
Yeah. I mean, you never know what these things are gonna come up with. I mean, I do have a heart for docs, because I think that, at least from what I've seen, and you guys can tell me more about this than it's actually the fact, but it's one of these where, these accreditation agencies, or, the American College of Cardiology or the American Diabetes Association, have these plans of care. And if you significantly, veer off of those plans of care, then there is potential liability there. And, and so it turns doctors into doers instead of thinkers. And I think we have some of the best thinkers in our country who are doctors. And so I prefer to let doctors use their brain and tell me what they think based upon their experiences, as opposed to a, observational study done by a pharmaceutical company. That's just not what I prefer. So I'd prefer to let you all think, as opposed to just being doers of a pre-formulated plan that I can probably get off of AI and do just as well.
Absolutely.
Well, actually, the AI does it better. And I had this, I can't remember who I was. I think I said this on a podcast. I was ranting about it. And I'm like, if you're just going to be an algorithm, a human algorithm, then get rid of the human, because the machine does the algorithm way better than the human. So I'm actually an impediment, because I forget parts of the algorithm. You want me there to be able to be another, like, conscious, soul-filled entity in a room, seeing stuff that, the algorithm can't see, and sensing things. And, if it's just algorithmic medicine, then you're going to be out of business, like, rapidly. Did you ever see that there was a bill going through Congress that said that, how was it worded? It was using machine learning and AI to write prescriptions in place of a license.
Oh.
America spends more on healthcare than any other country, yet we rank 48th in life expectancy. We spend trillions, but 200,000 insured people still declare medical bankruptcy every year. Clearly, the system is broken. But what if there was a way to take back control, to break free from inflated costs and red tape? That's exactly why CrowdHealth was created, a smarter, more transparent way to pay for healthcare. No middleman, no bureaucracy. Just a community of people helping each other when it matters most. Join the revolution. Go to joincrowdhealth.com and use promo code BSFREE for a discount on your first 3 months. Because your health should be in your hands, not theirs.
I haven't seen that.
I'll send you. I have a screen grab of the SB whatever bill, and that was months ago. That was probably 8-9 months ago, and I don't know that it went anywhere. But that's I predicted that about a year ago. I said when Pfizer came out with Pfizer Direct, where they were doing their own telehealth, I'm like, what's the next step? Is they got to get rid of the medical license because they have to buy me. When they're buying me to write a prescription for Pfizer vaccine or whatever, they're just buying my license. They're buying access to the patient. I'm the bridge between the the patient and the device. So if you just get rid of that and say machine learning does it better, machine learning will actually write the prescription. I said I guarantee you that's coming because that's what the guys that pay the politicians want to have happen. So that's what's going to happen.
Yeah, there's no doubt. I haven't thought too much about it to have a real conviction one way or the other. But I do believe that there's got to be an easier way. There's got to be an easier way to cut out some of the middlemen in this. And I think we're seeing it with ivermectin across the country right now, where I think there's become more of a willingness to open some of these over the counter things up to people that aren't going to really hurt them. And there's again an overregulation of some of these things that I think we can get rid of. The one thing that I thought would be amazing is I oftentimes wear the continuous glucose meter. And those are still like a prescription required thing for most of them. And so and therefore and FDA regulated. And so, given they're FDA regulated, they're so expensive because of all the FDA regulations you have to go through to make these things work. And I was like, I'm not diabetic. Like, I just want to know what my blood sugars are. And I'm not going to keel
Right.
over if the thing is wrong. If it's 10 points higher or lower than what it says it is, I'm not dying. I'm not diabetic. And so is there a way for me as a non-diabetic to have access to something just because I want to know what's going on with me? That doesn't feel like it needs to be regulated by the US government. And yet it is. And that's why I have to pay $150 a month or whatever when I have my continuous glucose meter because it's so darn expensive. I mean, that's ridiculous for me. And you guys have seen those, right? Like the
Oh
continuous
yeah.
glucose meters. I mean,
Yeah.
I bet you that the actual cost of goods for something like that is like a few bucks. Like it's next to nothing. And so why do I have to pay 150 or $200 or whatever it is now to have $3 or $4 worth of things on my arm? It bewilders me. And yet I think if everybody had a continuous glucose meter, we would see massive health improvements throughout our country. Yet we can't because it's $150 a month. Like that's preposterous. And I hope that RFK is able to do some things that allow us to get these prices down for some of these. Just I'll call them I want to know what's going on type of services. And in many places too, you have to get a prescription or you have to get an order to go get lab work. I'm like, why the hell do you
Yeah.
need an order to know what's going on in my body? I'm not going to keel over. Well, we're afraid that if you get results and they're bad results, there's nobody there to tell you that they're bad results. Okay, well, is that worse than me not getting my blood work done at all? Like, it doesn't make any sense. And so,
Or you
it's
can do it and then
government.
you pay way more than if you're going through your physician and then they bill the insurance. Like I've tried to do that, and
Exactly.
the price is like 5 times as much if I just want to order my own blood count and iron levels.
Or I take my results, I throw them into ChatGPT or something, and hey, ChatGPT,
Right.
tell me what's going on here. Is there something I need to worry about? And if there is, then I call you and I say, hey, I see that my fasting insulin is super high. Like what my A1C is 8. Like what do I do about this? Right? Like oh okay, let's talk about it. And I think a lot of it has to do with just control. I mean, ultimately, that's where I think a lot of these government motivations come from, is
Yeah.
just controlling the sheep underneath them. And I think it fires me up, as you can probably tell.
Well, yeah, and it's it really. I wrote a Substack about this a little while ago. I called it the Prophets of Baal, but I spelled profits PROFITS, and really, the entire healthcare industrial complex has this sort of false prophecy, false deity kind of thing to it, right? Like and that's what it is. It's like, well, you can't possibly get blood work because you can't understand it. You need the prophets to read the tea leaves. You need the Ouija board to tell you what's going to happen. You need, well, no, I don't, because when I try to watch college football and I see a 300-pound woman dancing, trying to sell Jardiance by telling me that her A1C is in good control when she's clearly objectively very unhealthy. I'm like, no, you're just normalizing really terrible health habits. That's it. So let me take control of me. And if I make a mistake, well, that's the price of freedom. I also ride a motorcycle without a helmet once in a while. That one's on me,
On CrowdHealth.
Yes. Probably not.
Yeah, no, I mean, look, we want you out road and riding your motorcycles. We've actually funded a lot of motorcycle accidents, and unfortunately, everybody has been okay. No, we're all about you going out and doing your active activities. I mean, the interesting thing about us are number 1 and 2 things that we request from the community to fund. One is pregnancies. So we just have a lot of people in their late 20s and 30s, and they're having babies. That happens. And we have a lot of active injuries. So it's people out doing something, being active, and stuff happens. You're on your motorcycle and you fall off, or you're playing pickleball and you tear your ACL, or you're mountain biking and you face plant. It happens. And I sure as heck would prefer to fund those things. I'm all about funding babies. I'm all about funding people who are out being active and enjoying life. What I don't want to fund are the lifestyle issues that are, decades old bad habits, and people just expect others to pay for the consequences of that. That's what I don't want to fund. And that's what CrowdHealth members are not funding. And so that's again, big difference between us and health insurance, not to mention all the crazy things that health insurance are paying for nowadays that I'm, personally and morally against. But that's another story.
Right, but that's a really, really important point. Is you're paying for things with your health insurance that you may totally despise from a moral perspective. You're also funding people to live terrible lives. I mean, this sounds really judgy and whatever, but it's the truth. I got so upset, and the reason I left primary care was because I was being told what I have to do. You got to check everyone's feet who's a diabetic. You have to do all these metrics because that's how we get paid. Like all this insanity, and finally I just said, this is immoral. Like I'm actually the way I'm treating like take for instance type 2 diabetics is actually allowing them to live a crappy lifestyle, instead of encouraging them to, with, spending an hour and et cetera, et cetera. And I was just like, this is immoral. Like I felt it was immoral. And in my realization was, if you do unpleasant things for money, that's called a job. If you do immoral things for money, you're a whore. And I was like, I can't be a whore anymore. I can't, because I'm not.
Well, then, in the same way, they force you to look at the American Diabetes Association and say, okay, let's look to them for guidance. That you go on their website and they've got all these recipes for diabetics, and it's like, 50, 60 grams or something like that of carbohydrates. And you're like, what the hell are we doing? Like, this is absolutely bonkers, but it's like white rice or it's wheat bread or something. You're like, guys, like, and they will till this day refuse to acknowledge the fact that you can reverse type 2 diabetes with lifestyle habits.
Right.
They think that type 2 diabetes is a chronic disease that can never be, reimagined, and it can. Like we've seen this over and over and over again. I mean, I bet you hundreds of thousands of people have been able to reverse their type 2 diabetes by lifestyle issues, yet that's not the path of care for these people. And it's stinks because 25 cents for every dollar that we spend on healthcare is going to a person with diabetes. Imagine what our healthcare system would look like. And by the way, vast majority, it's like 90% are type 2. So it's only 10% type 1. And there's not a lot you can do for them right now. But type 2, we're spending 25 cents of every dollar on a diabetic. That's crazy town. And, if we just fix that, we can fix our healthcare problem. And so, that's the system in which we live, in which I think you said before, it's like, I don't want healthcare to be restructured or changed. Like, I think you used a different word, but I want it burned down. Like, we need to burn it down to the ground and start again, because there's no
Mhm.
iteration from what we have that's going to have a significant impact on the future of healthcare. Like, there's just no legislative willpower to have a significant, massive change. And so that's what we're trying to do is like, look, we're gonna build a parallel system to this complex, inefficient, bureaucratic health system we have over here. Let's build something parallel to that. We can still use some of that infrastructure. We can still use the doctors, but we're going to pay in cash as opposed to health insurance. And we're going to gather a group of people together who really care about themselves. They care about their bodies. They care about their lifestyle, and they don't want to end up at 80 years old without a leg because of long-term diabetes. And so that's what sets us apart. That's what sets our community apart. And I think there's something special there.
So I'm curious, man, it would be great to have, or if you had some connection into the current legislation, the whole Make America Healthy Again model, to kind of share your passion and what's happening with CrowdHealth as a model to really impact and change not only the cost of healthcare, but making America truly healthy by innovating these changes. I know we kind of talked about it earlier before we started recording, but do you think there's going to be much change with current government now for that you're going to see that's really going to impact changes what you're doing with CrowdHealth, or do you prefer that they stay out of it and let things like CrowdHealth and that kind of innovation be the ones to direct the changes across the country? Because you're right, we need to burn it to the ground, but I think it's best if innovation and business like yours takes hold and people get interested rather than government kind of telling everybody what to do.
Yeah, I think the best chance we have is for government to be less involved in our healthcare as opposed to be more involved. And so I
Yeah.
think that deregulation around healthcare is the absolute next best step. Is there the legislative willpower to do that? I don't know. My guess is probably not. We still, I think the Republicans hold, all the House, both the House and the Senate and the legislative branch. I just don't think it still feels a little divided. The House is really, really close, in terms of the mix there. So I just don't think there's enough legislative horsepower or willpower to do what we need to do to get this corrected. I think, and it's a tangential kind of point, but we saw it in the last budget scenario where they come in, they say we're going to rip the budget apart and we're going to significantly reduce costs, and that was kind of what they campaigned upon. But in reality, what happened? The last, I know they're going through reconciliation right now, but the Senate still has a ridiculous budget that is still bloated and massively outspends what we take in every year. And so I just don't think there's enough willpower on the legislative side to do some of these things that are big, impactful, and innovative. I think they still want their jobs. And so anything that's going to be massively disruptive, I just don't think they're willing to take on. I mean, we're seeing, Massey on the House side, Rand Paul on the Senate side. I think both stand up and take a stance. But I mean, one on each side is not going to do it. So I just don't think there's enough there to make anything significant happen. I think there's some good iterations. RFK has made the healthy thing of his primary focus. I think he's going to try to create a more healthy environment in which we can thrive. I think that's one side of the equation. I don't think the price side of the equation is going to be impacted at all. I mean, if anything, it might even get worse. So I don't have a lot of hopes for the current administration's ability to do anything of significance.
Yeah, I think the key is doing exactly what you're doing, which is just you create the parallel universe, right? Like, YouTube started in 2005. That was, and then it was just a bunch of, goofy nerd kids doing stuff, and then kids wrecking on skateboards, and then cat videos. And it was just kind of like, yeah, whatever. You just ignore it. It doesn't matter. It doesn't matter. Well, now alternative media, which is what we're doing right now, has it's where people actually go for real information. They would rather listen for three, like, who in their right mind in 2005 would have thought 2, 3, and 4 hour podcasts were going to completely politically and culturally alter the United States and the entire world? You're like, no one's going to do that.
Yeah.
We know what we do in talk shows. It's 10 minutes. It's 5 minutes at a time. We've got the formula. Well, your formula is done. And the insurance model for healthcare in the United States is done. They just don't know it yet. They're the dinosaur standing in the swamp. The sky has just gotten really bright, and all of a sudden there's going to be a shockwave. And that's why I get super ramped up when I hear about, your innovations, because take care of yourself, pay for yourself. All I want to do is the government to deregulate. That's it. Those are that you do that, healthcare would be so great and so cheap in this country. It's unbelievable. So just, this is so empowering to individuals. You as an individual, you save yourself. The government's not coming to save you. No one's coming to save you. There's only one savior, and we celebrated his resurrection a couple days ago. That's it. No other savior. It's not Donald Trump. It's not, Bernie Sanders. It's not Colonel Sanders. It's you.
What about Elizabeth Warren? She'll save us, won't she?
Yeah, exactly.
You forgot her.
Pocahontas.
I know.
Yes.
I 100% agree with you. And this is, look, you just said YouTube was started in 2005, I think you said. So here we are 20 years later. And this is going to be the long game. Like, this doesn't change overnight. And I think this could take a decade or two. Ultimately we need people to actually vote with their wallets and say, hey, I'm not going to support the system that has gotten us to where we are. I'm going to support a new system. And, enough people say that, and it starts to, the tree starts to crack and fall, and the health insurance system comes down. And I think we're a way, way, way better alternative. And we're trying to be 10x better than health insurance. And I think we're, pretty close to being there. So we actually have a meeting in Vegas with all of our internal people, and we're inviting some members to come along with us. And we're calling it 10x, which is, how do we become 10x better than health insurance? Because Uber is 10x better than cabs. Netflix is 10x better than Blockbuster. And so we want to be 10x better than health insurance as a way to pay for your healthcare. And I think we're there. When we asked a bunch of our members, like, help us, be 10x, what are your recommendations? We had a bunch of them. They're like, you're already 12x, you're already so much better. So, you don't just keep doing it. So we're trying to get better, and 10x is our goal.
No, this is great. So we're getting pretty close to where we need to wrap things up. So where can people find you, people that want to join CrowdHealth if they're just curious?
Well, and of course, we didn't talk about the financials of how much it costs or how much they're saving to pay for CrowdHealth compared to what they're doling out for their great health insurance.
I don't even. No, it's got to be 12x because it's just insane on the other side.
Yeah,
it's insane.
So
I'll give you. I'll give you. I went to healthcare.gov this year just to see what my family would be on an Obamacare plan. It was, I think it was $1,400, and it was like 16,000, 14 or 16,000 deductible or something, which means I pay the first $30,000 before the health insurance plan pays anything, which is crazy to me. With Crowd Health, I paid for my family. Let's see, it was about $475 this month. Family of four, $475. So I'm saving $1,000 a month almost. And I pay the first $500 of any health event as opposed to the $14,000 or $16,000 deductible. And so I think my family saved $20,000 last year by using Crowd Health. And so, that gives you a little bit of kind of context for, you can do it significantly cheaper with this kind of payment method as opposed to, going into health insurance. But if people want to come and hang out with us, it's joincrowdhealth.com. Join Crowd Health on all of our social media, platforms. So go and see us there. And if people are joining us for the first time, use BS free, and you get $99 a month per person for the first 3 months. So come and try us out, and if you like it, great. If you don't, then that's fine too. But I'll tell you, most people love it, and we think you will too. They love it 10x more than health insurance. In fact,
I love it.
Yeah, and extra money back into their bank, wallet, whatever you want to call it, and not paying for crap they don't believe in. And I just think that's totally a revolutionary way to do health insurance, prepaid health, crowd healthcare, whatever you want to call it. I think it's got a better name for it. Yeah, so wonderful. We will link that in the show notes. Thanks for coming back again and having a conversation. People can go back and listen to episode 327 for more details if they want, or just go to the website. It's all there. Any last parting words, Andy?
No, come and join us. Help us start a revolution and burn this system down. We'd love to have you.
Outstanding.
Amen to that. We totally agree.